Welcome to Session 5 of the Well Works for You Sleep and Your Health e-learning series. In this session, we will review the relationship between stress and sleep and discuss ways to manage stress to improve your overall sleep. Additionally, we will review other factors that impact your sleep, such as oversleeping, jet lag, and menopause. Please keep in mind that the information being shared in this e-learning series session is educational in nature and not intended to be a substitute for medical advice. If you have any further questions on any of the information in this session, please contact your healthcare provider. Stress and sleep can create a vicious cycle together. You're stressed, so you can't sleep. Then your lack of sleep makes you more stressed, and so on. Let's take a closer look at this. When you are stressed, it may cause your mind to wander and lead to an overwhelming sense of worry that keeps you tossing and turning in the night. Stress causes a surge in hormones like adrenaline and cortisol that increase in alertness, making it more difficult to relax into a sound sleep. This cycle continues. When you are not getting enough sleep, you experience stress. When you don't sleep well, your body keeps pumping out those stress hormones. The next day, you feel more stressed. The following night, you find it harder to fall asleep, and so on. So what happens in your body when you are stressed? The stress response is often called the fight or flight response. The changes in the body that occur during this response are activated in order to give us increased strength and speed in anticipation of either fighting or running from the perceived or real attack, harmful event, or threat. Your body responds to stress by increasing heart rate, blood pressure, respiration or breathing, blood flow to muscles, perspiration or sweating, and blood sugar. In many instances, this flight or fight response is a positive change. It gives you the strength and mental quickness you may need to make a difficult decision or overcome a challenge. When you are stressed, your nervous system doesn't calm down for rest. Instead, your brain remains hyperactive and can keep you wide awake, increasing your chances of insomnia and impacting your overall quality of sleep. With good stress management, including practicing a relaxing bedtime routine on a regular basis, you will increase your chances of better sleep quality and getting the recommended amount of rest. To monitor your stress, start by assessing and identifying your triggers. What is causing you stress? What makes you feel angry, tense, worried, or irritable? Some examples are overscheduling or having too many things on your to-do list, saying yes too often to projects or tasks, personal relationships and challenges, job challenges, financial stresses, or never taking time for yourself or to relax. Once you have identified your stress triggers, think about strategies for dealing with them. Identifying what you can control is a good starting point. Get support. Ask for help from friends or family members if you have more stress than you can manage. If you feel like it is more stress than you can bear, seek professional help from your physician or a mental health counselor. Be realistic. Don't take on more than you can handle. Organize and minimize clutter in your workspace or at home. This can help lessen stress, allowing you to work more efficiently. Prioritize. Complete the most important tasks first. Be positive. Negativity only feeds into stress's power. Learn to say no. Saying yes too often can also leave you overscheduled and unable to focus on your own goals. Be good to yourself. A healthy lifestyle helps you to cope with the effects of stress. It is much easier to cope with stress after a restful sleep, so try to get in at least 7 hours nightly. Choose healthy foods such as fruits, vegetables, and whole grains. Do not skip meals and drink plenty of water. This can help you to fight off the effects of stress more easily. Take part in leisure activities or hobbies. Try to balance your work-life schedule. Making time for life outside of work is important. When planning your week, incorporate activities with family and friends. As we have discussed throughout this learning series, creating a relaxing bedtime routine helps enhance your overall sleep quality and quantity. Relaxation is particularly effective for good sleep and stress management. One form of relaxation that can be performed before bedtime is the body scan technique. This technique has been found to be effective for improving general well-being, decreasing physical discomfort and pain, and reducing stress levels. You can practice this by lying down or sitting up comfortably. Close your eyes, typically starting with the lower body and moving to the upper body. Mentally scan your body, noticing each area. As you do this relaxation exercise, concentrate on each group of muscles or part of the body individually and observe. Just notice each area without trying to change anything. Become aware of the different areas of the body and tune into how they feel. Practicing regular mindful breathing exercise can be calming and a great way to alleviate stress. One type of deep breathing technique is called the 4-7-8 or relaxing breath exercise. This type of technique can be done anywhere and in any position. If possible, close your eyes. Place the tip of your tongue just behind your upper front teeth. You will be exhaling through your mouth around your tongue. Try pursing your lips slightly if this seems awkward. Exhale completely through your mouth, making a whoosh sound. Close your mouth and inhale quietly through your nose to a mental count of 4. Hold your breath for a count of 7. Exhale completely through your mouth, making a whoosh sound to the count of 8. This is one breath. Now inhale again and repeat the cycle 3 more times for a total of 4 breaths. Progressive muscle relaxation is a relaxing and effective technique for reducing overall body tension. This simple technique involves tensing and relaxing all of the major muscles in your body in order from your head to your feet. By tensing your muscles before relaxing them, you enable yourself to relax them more thoroughly after you release, letting go of physical tension and stress more effectively. This exercise takes at least 15 minutes. You may sit comfortably in a chair. However, it is more effective to stretch out and lie down. Begin by tensing all the muscles in your face and scalp. Hold this for the count of 8 as you inhale. Exhale and relax completely, letting go of tension. Continue down your body, repeating this process with each muscle group. As we talked about earlier in this learning series, meditation and yoga can be extremely calming for the body and mind and a beneficial part of a relaxing bedtime routine. Visualization or imagery is another relaxation method that can help relieve stress and tension while leading to better sleep. Through visualization, you create images of happy, calm situations like sunning on a beach or sitting on top of a mountain taking in the magnificent scenery. Massage is an effective way to relax both your body and your mind. There are a wide range of massage techniques, so be sure to discuss your choices with a professionally trained massage therapist to ensure you select the most beneficial option. Listening to music has a profound effect on the body. Slow tempo music can actually lower heart rate and blood pressure. And music is a mood enhancer. It can help in reducing tension, fighting depression, and relieving pain. Journaling, write it down. Get those wandering thoughts and worries or to-do tasks out of your head. Just remember, you don't want to use electronics too close to bed, so go back to pen and paper or try talking into a recording device. There are a few additional issues regarding sleep that we have not discussed. Oversleeping, jet lag, and menopause may also impact the amount and quality of our rest. Though it is not common, getting too much sleep can also be harmful to your health. Oversleeping is categorized as sleeping 11 or more hours on a regular day-to-day basis. This may be caused by a sleep disorder, an underlying medical condition, or another mental health issue. Chronic oversleeping can increase your risk for headaches, back pain, diabetes, obesity, and heart disease. If you feel that you may have an issue with oversleeping, it is important to speak with your healthcare provider. Jet lag, also called jet lag disorder, is a temporary sleep problem that can affect anyone who quickly travels across multiple time zones. Studies have shown jet lag results from an imbalance in our body's natural biological clock caused by traveling to different time zones. This results in our bodies telling us it is time to sleep when it's actually daytime. Jet lag symptoms may include disturbed sleep, such as insomnia, early waking or excessive sleepiness, daytime fatigue, difficulty staying alert or concentrating, gastrointestinal problems such as constipation or diarrhea, stomach problems, or just not feeling well. Here are some tips to help with preventing jet lag. Arrive early. If you have an important meeting or other event that requires you to be in top form, try to arrive a few days early to give your body a chance to adjust. Get plenty of rest before your trip. Starting out sleep deprived makes jet lag worse. Gradually adjust your schedule before you leave. If you're traveling east, try going to bed 1 hour earlier each night for a few days before your departure. Go to bed 1 hour later for several nights if you're flying west. Try to get outside in the sunlight whenever possible. Daylight is a powerful stimulant for regulating our sleep-wake cycle. Avoid alcohol or caffeine at least 3 to 4 hours before bedtime. These can keep you alert and awake. Stay hydrated. Drink plenty of water before, during, and after your flight. Dehydration can make jet lag symptoms worse. Try to sleep on the plane if it's nighttime at your destination. Earplugs, headphones, or eye masks can help you get sleep. If it's daytime where you're going, resist the urge to sleep. From perimenopause to postmenopause, women report the most sleep problems. Hot flashes, which lead to night sweats, and mood disorders, which lead to anxiety, are the most common cause of sleep issues. Hot flashes may interrupt sleep, and frequent awakenings cause next-day fatigue and fussiness. There are many options available to treat menopausal symptoms. Discuss your treatment options with your healthcare provider. Here are some sleep tips during menopause. Eat healthy. Avoid large meals, especially before bedtime. Some foods that are spicy or acidic may trigger hot flashes. Sleep in lightweight clothes and layer your blankets to accompany for the shifts in body temperature. Use a fan or air conditioner to keep air cool and increase circulation. Keep a cloth and a bucket of ice near your bed so you can cool yourself quickly. Limit caffeine and alcohol intake, especially a few hours before bedtime. Reduce stress and worry as much as possible. Try relaxation techniques such as massage or meditation, and practice a relaxing bedtime routine each night. Exercise regularly, and discuss any issues including depression or anxiety with a healthcare provider. Action plan to better sleep. Over the next week, think about the things that cause you stress regularly. What symptoms of stress do you experience? Try various stress management techniques to determine which ones work best to decrease your stress. Continue practicing a relaxing bedtime routine nightly, incorporating some different relaxation techniques you learned in this presentation. Take note of how you are feeling once you have been practicing stress management over the next couple of weeks. Here you will find the resources that were used during Session 5. Thank you so much for listening to Session 5. Coming up in Session 6, we will wrap up the e-learning series with Creating Healthy Sleep Habits.